Well, the lockdown has certainly changed life for all of us, and for many of us, we've started wearing masks. But there are some concerns that we're either buying the wrong face masks or using them incorrectly. And to tell us more about this, we're joined by the University of Cape Town's Head of Infectious Diseases and HIV Medicine, Professor Marc Mendelson. Good evening, Prof. Thank you so much for joining us. Now, tomorrow night, we're expecting to hear from the President possibly an easing of the lockdown restrictions. If we do see more economic activity, more people back in their jobs, do you think it would be a good idea to make it law? It's currently just recommended, but to make it law for everyone to wear face masks in public?
Well, good evening, Sally. I think it's difficult to say whether it should become law itself. I definitely think that, consistent with the messages that have already come from a minister and government, that the use of cloth masks by the public is strongly recommended. And I think it's a really critical intervention, one of a number, that as we ease out of lockdown, that is going to be important, particularly in areas where there's a lot of crowding. It's difficult to keep the physical distancing, social distancing as we're calling it, which is one of these, really critical interventions, along with hand hygiene, along with decontamination of surfaces in the home and elsewhere. And when you're sick, obviously getting help and self-isolating. So the cloth masks are really an extension, really a good cough etiquette. We've already taught that when you do need to cough, we try and get people to cough into the arm. And the cloth mask really is to try and reduce the amount of droplets that potentially have virus on them in and around the surroundings that you are in. So by wearing the cloth mask, if everybody wears cloth masks, then we are all reducing potentially the amount of virus that's around in close proximity to other people. And therefore, we're protecting ourselves and others.
Is there a wrong mask to buy? Now, we know that we shouldn't buy the medical masks. We've got to leave those for the medical fraternity. But is there a wrong mask to buy? I mean, lots of people are making masks and selling them or even giving them out free. So first of all, is there a right and a wrong mask to assess? And is there a right and a wrong way to wear a mask?
So, look, I mean, we're suggesting that masks should ideally be made of 3 layers, thick weave on the outside, the internal layer being slightly less for more comfort, either, soft cotton or a polypropylene spun weave. So, there are some very good guidelines on the National Department of Health and NICD websites about, what the masks should look like and should be. In terms of, the do's and don'ts of wearing the mask, the critical issue is that you should have at least 2 masks, so one being worn and one spare waiting. The mask, once you put on the mask and you fit the mask to your face, the critical thing is to try not to touch the mask, because obviously the surface of the mask may be contaminated. May get contaminated, and you don't want to touch it, because once you touch it and then you touch your face, maybe your eyes, nose, etc., when you're not wearing the mask afterwards, then you're going to increase transmission. If you do touch the mask, we recommend that you do, you wash your hands with soap and water or alcohol-based sanitizer.
Can I just jump in there and ask you why that matters? Because we're told that the only reason you're wearing a mask is to protect other people from your possible infection. So if I'm already infected and I touch my own mask and then I rub my eye, why would that matter?
Yeah, I mean, the thing is that you're going to be in environments where perhaps not everybody is wearing a mask. There will be, have been transmission, potentially if you're in an environment where people aren't wearing a mask and they are infectious, they're either pre-symptomatic or symptomatic, that could get on the mask. Granted, what we're trying to do is optimize this.
Sure.
So when the other issue is when you're taking your mask off, really important, again, not to touch the front, but to take it off from behind the ears or your straps off, then put it in to be able to be washed.
Right, so that's really interesting, good mask etiquette. I have to ask you, as head of HIV medicine at UCT, there is some discussion about antiretrovirals and whether they might provide immunity from COVID-19 or some sort of protection. I've looked at the WHO site. It doesn't seem conclusive. Is there any thinking on this, on whether there might be validity to it at all?
So antiretroviral therapy wouldn't itself give immunity to the virus. HIV-positive people living with HIV, are just as likely to get infected by SARS-CoV-2, the coronavirus, as anyone else. I think where this comes from largely is that in the 2002 SARS outbreak, there was an observation that one of the antiretroviral drugs, lopinavir with ritonavir, which we know as Eluvia, did reduce, in part reduce the severe outcomes and mortality in one small study, which wasn't a proper, large study, but that's where some of the evidence comes from, and some of the work around the MERS virus as well, which is also coronavirus. So there was a question mark around whether a particular antiretroviral may be of use. And South Africa, along with many other countries, is going to be part of the WHO Solidarity Trial. And one of the arms of that trial is lopinavir, ritonavir, with or without another drug called interferon. So that should give us an idea. But the reality is that, the rest of the world, with their HIV prevalence being relatively low, we just don't have the information at the moment to know whether, what would be protected and what isn't. What we can say definitely is that in this time, it's critical that people living with HIV get on antiretrovirals if they're not on them, and those that are on antiretrovirals, that you really take them well and optimize your treatment, because the more immunosuppressed that person is, we are worried that the more potentially severe the outcomes if you were to become infected. So that goes along across the board for any medical illnesses that people have. We really suggest that people optimize their treatment and really get to good levels as best they can.
Thank you so much for that solid advice there, Professor Marc Mendelson, Head of Infectious Diseases and HIV Medicine at the University of Cape Town.